Well, I would say that every year is a year where you can witness some advances, either in the field of, for example, robotic surgery, which is nowadays one of the most rapidly evolving fields with a lot of indication where you can use this technology, and it's always exciting to, for example, see the live surgery session other than that, of course, there are always the advances in the field of more in the medical oncology for advanced cancer, immunotherapy. Recently, has taken a big role in the management of some urologic cancers, and there are a lot of studies going on, and we expect results to come out soon from these studies. So we can probably expect to have significant results in the next future. That's a very interesting question, because one of the challenges when you attend a congress like this, then if you look at the program, and then you ask yourself, okay, where should I spend this my time today, and especially this year, where I have noticed that there have been some changes in the way the scientific program has been structured. It's very difficult, because you can see that there are a lot of parallel sessions going on at the same time on different topics, but all of them very interesting. And of course, I think each of the attendees can, based on his own personal interest, can pick, what is the place to go and take home a good amount of information, new information. These are two very different healthcare systems. In the USA, there are different levels of healthcare providers, and also the payers are different. In Europe, you have the national public systems have the majority of the share in the market. So I think one of the principles that you can see in European countries, the universal coverage, healthcare for everybody. I think it's a principle that it should be at the top of the priorities for any country, and this is something that, for example, you don't have in the US. I think it's a major problem. Right now, also there are some new political development in the US. So we'll see what the future holds there. But certainly in the US, it's more a business mindset, and and that is not necessarily. It can be a good thing from one side, from a standpoint of advancing with technology and trying also to implement new therapies and research funding. That makes it easier, but on the other hand, the fact that it's everything is private then doesn't allow again to have it becomes problematic to have all people to have access. Well, yes, absolutely. Robotic surgery has been really a major breakthrough of our field in the last 10 years. Indications have expanded tremendously. It started only for focused on prostatectomy, and as also the technology has improved, now we have the latest generation system for robotics. Also, the indication have expanded, and you can certainly tell that it has been implemented worldwide on a very large scale, and this can certainly translate into also better outcomes for the patient. That's I truly believe that, in the sense that robotics allow more surgeons to perform minimally invasive surgery. For example, in the field of partial nephrectomy, there have been studies showing that the utilization in centers where robotic technology is implemented, there will also been a shift towards nephron-sparing surgery, so more conservative surgery compared to radical surgery for kidney cancer, which is a good thing. The big problem remains the cost, and nowadays where you have a lot of constraints and limitations, and there is always discussion about cost of healthcare. This can be a problem, and the other problem is that we have only one company which has made a tremendous job during past years, but of course it can be seen as a downside of the current situation. So I would say for the future, certainly there are a lot of projects going on with different companies now are investing money in trying to develop possibly in near future other system that could come to the market and that could eventually also lower the costs. But of course this is hard to tell. It's an hope that we have, but certainly the system we have nowadays is very effective, and also that has changed also the learning process of young surgeons, of young generation of surgeons, and ultimately I think this is a good thing for the patient. Well, a congress like the EAU is certainly unique in the sense here you can see the urology at its best at an international level, and congress like these, meetings like these are always a opportunity to share ideas and networking with colleagues, old friends, and that's a good feeling. And every year there is always something that you can learn by attending a session, by attending a poster session, or watching a video, or a presentation in state-of-the-art lecture in the main room. It's I think the most important thing is certainly the networking. There is also the scientific part, of course, but the networking, the collaborations are the main things that one can benefit when coming to these meetings. Meetings are nowadays very evidence-based driven. That means that you come here, you learn what is the status or the state of the art of the specific topic you want to look at, and that certainly is something that you can take home and try to then implement in your clinical practice. So I think it's always a major. It certainly is something that can be translated, what you learn here, what you see at the meeting, in your clinical practice. It's not, of course, there are other things that impact what you do, but meetings like these can in a positive way try to be also make you try to improve yourself and be critical with yourself, so you can also challenge what you do and see if there is anything else you should do, which is always a good thing. Well, again, with such a big program and articulated program, it's difficult to try to find one take-home message. I would say that probably the message is that, and we recently also wrote a paper on this, is that it's we are basically going towards an era of precision, with precision medicine and precision surgery, which means that you want to always try to offer the patient the best combination between, for example, in the oncology field, the control of the cancer and also the preservation of quality of life. So you have always, and this can be facilitated by using latest technology, by using, for example, biomarkers. So all these things you have to try to keep up and try to then apply these things in your clinical practice.